We must constantly look at things in a different way.
The Healthcare Education Transformation Podcast was created by two physical therapists out of the desire to learn more about the different educational roles in physical therapy and healthcare, and how healthcare education works by talking with educational leaders and people with different perspectives within physical therapy and across interdisciplinary lines on how education can be improved to disrupt the status quo of healthcare education. This is our journey, and thanks for listening. Are you a third-year physical therapy student that excels on tests when you have study guides, checklists, and deadlines? With all of the information available about how to prepare for the NPTE, it's easy to get disorganized and not feel prepared going into the big day. NPTE Prep Success is an online course that provides PT students easy-to-use study guides and step-by-step guidance through the NPTE preparation. To learn more, visit kylericeprep.com. Thank you again all for your continued support, and now for the show.
Hello, everybody, and welcome to a special episode of the Healthcare Education Transformation Podcast. This is part 2 of my mini-series on direct access. The APTA has gone out and said that they've done a really great job of getting all 50 states some form of direct access. And while that's true, I have a couple of people here in the room tonight that, we're all in Texas, and there's a common theme here. We have direct access in the fact that we basically can do an evaluation, and then that's where it stops. We've got to kind of go ahead and get doctor's orders after that to continue to treat our patients. So, gentlemen, if you wouldn't mind introducing yourself, we'll go Mark, then Mike, then Dana, and we'll get into a little bit about the definition of direct access and what it means to you.
All right. First, I'd like to thank F Scott and the Health Education Transformation Podcast for having us on tonight. I know we just kicked off the legislative session here in Texas, and so bringing this information to the public is going to be extremely important and valuable. And the Texas Physical Therapy Association and the American Physical Therapy Association's goals of getting access here in the state of Texas in 2019. So my name is Mark Milligan. I'm a physical therapist in Austin, Texas. Several different practice settings, home health, private practice. Also involved in education at 3 different PT programs, as well as continuing education across the country. Immediate past president or past chair of the Capital Area District here in Austin, and happy to be here.
Thank you to F Scott and Brandon and the Health Education and Transformation Podcast for having us on tonight. I'm excited about the potential for expanding our access to our patients. I'm Mike Connors. I'm a PT in private practice, currently in the Dallas-Fort Worth area. I'm an educator, a business owner, entrepreneur. I'm kind of a jack of all trades, a master of none, but excited to be here. Currently the president of the Texas Physical Therapy Association. We've been involved in this direct access battle, I'll call it, for the last 5 legislative sessions, so 10 years. Definitely a run for all of us that have been involved. I think this is a huge opportunity for us, and I'm looking forward to contributing to the body of knowledge and the awareness of our efforts this legislative session.
Thank you guys again for having us. My name is Dana Tew. I'm in the Houston area. I'm a PT for a company called Results, an outpatient setting, and then I'm also the CEO of OPTIM PT. It's a manual therapy fellowship, COMT. We've got a PTA program and a OCS prep course as well. Locally, I'm involved in the SED, and then for the state, I'm the governmental affairs chair for Texas, and then I'm also on the PAC board, the fundraising arm for the TPTA.
Awesome, guys. Well, thank you so much again for coming on and for giving us your time tonight. I'd like to start with this quick question. What does direct access mean to you? I mean, the definition in theory is that patients can come in off the street and just receive physical therapy. But I'd like to hear from you guys, really, what does direct access mean to you, both from a clinician standpoint and even a patient standpoint?
You know, I think it's really from looking at the clinician first or the patient first. For the patient, it gives them an option. It gives them somewhere else to go, so in a lot of states, patients are able to pick the provider that they feel that's best. And, patients have a lot more resources now. They're a little bit more educated than in the past. They know, when and kind of what provider that they want to see. So anyone that's in pain, they have the choice. They get to go see a physical therapist if they want. They get to go see a PCP if they want. As a clinician, it helps me get to people faster, right? So we know people that are having low back pain that see a PT first are going to get better results. They're going to get out of pain a little quicker. They're going to get prescribed medication less. They're going to get less imaging, less surgery, all of those things. So it enables me to get people better faster.
I like to think of direct access almost as patient access, or, kind of as a alternative view of how we think about the issue more as putting the patient first instead of direct access. To me implies that it's more provider centric instead of patient centric. So like Dana said, putting the patient first, leveling the playing field, giving the patient the choice to opt for their best, lack of a better phrase, choice of healthcare provider. You can opt PPOs to go see an orthopedist, a primary care physician, a chiropractor, but you don't have that option to seek out the services of a physical therapist. The other thing that comes into mind with direct access is the entire opioid epidemic. The fact that we are the first line defense for the option of opioids versus, surgery versus the, physical therapy. So to give the patient a choice, do I want surgery, imaging, drugs, or physical therapy? I think most patients at this point in time would say, I'm going to opt for the more engaged form of intervention of physical therapy than, pharmacotherapy, imaging, and surgery. That they want to be a more active participant in their healthcare. They're taking on more of the ownership of the expense of their healthcare. So also to Dennis' point, patients are more educated consumers because they're paying more, like they do in other aspects of their lives. So if we give patients the ability to be able to opt to choose their provider that best meets their needs, it puts the patient in the driver's seat and gives them the ability to choose their provider rather than having it dictated to them by a pedagogical approach.
Yeah, Dana and Mike make amazing points. First of all, from the patient perspective. Second of all, from the clinician, the clinical perspective. I'd like to bring just the business side of it, right? In the state of Texas, you can almost see a restriction of trade being in place by this law, right? So for business, from a business perspective, even if I wanted to trade or give away my services for free or barter or figure out a way to some other ways compensate each other for the care, I still couldn't do that without a referral from a provider. And so really the patient and me as a business owner don't have the option to engage in a business relationship without a third party authorizing that ability. And so I think there's so many different aspects of access and what it means to both clinicians, patients, and businesses that people don't understand the impact that small businesses need to have that access to their patients or to their customers. Imagine having to get a referral to get a pizza, or get a referral to get gas, or to get recommendations for any other aspect of your life. It really doesn't make sense in this day and age, especially with the level of education that physical therapists have, and the demonstrated and proven ability to be a first line provider for musculoskeletal care.
And to add on to that, Mike, and this kind of speaks to the ridiculousness of the current situation. I had a member at Texas, TPTA member contact me this week, and he's a business owner. Also was an ATC, so he's an ATC, athletic trainer, and a PT. And he was telling me that he had more access as an athletic trainer, so he could have clients that were in pain or not in pain, and he was able to prescribe or to assign exercises to them to help them in the rehabilitation process. Now that he's a PT, he's not able to do that without the referral. So he's actually sort of decreased his number of clients now. And with the referral situation right now, a lot of patients are just going to wherever the physician tells them to. So he's seeing a big decrease in the number of referrals as well. So he told me last night, if things don't turn around quickly, he's moving to Oklahoma is really the only option that he's got to stay in business. And that's just absurd.
Yeah, I mean, go ahead, Mark.
To add one last thing onto Dana's point is that a patient can, if they have knee pain or elbow pain or wrist pain or back pain, they can go see any other provider they want in the state of Texas. Any other person. They could have massage, they could have hot rocks thrown at them, they could have somebody walk on their back, they could have anything done to them they want, except see a physical therapist for that condition. And that's a disservice to those people and the people of Texas.
Yeah, I mean, I'm still relatively a newbie here to Texas. I've only been here a little more than 2 years now. And when I got here and saw what the laws were, I was dumbfounded. I literally was floored. But, I said, okay, well, we'll learn, how it works and what we need to do to change that. Then I started talking to the likes of these wonderful gentlemen and a lot of other people that are doing really good work to try to get this changed. And I didn't realize how rough of a fight it's been and how much of an uphill battle it's been for something really pretty much absurd and ridiculous in my point of view. But, I don't get to make those rules. But if you guys wouldn't mind, and anybody can jump in on this and kind of let the audience know where we're at. But there's been a little bit of a shakeup lately in some of the positions there amongst lawmakers, especially the chairman of Health and Human Services Committee. I'll just leave it at that. But where are we right now? Where do we stand as far as direct access and the lawmaking process and moving things forward? What are the next few steps coming up here in the Texas legislative cycle?
So we've got a House Bill 29, that was what's her name? Ina Minjarez out of the San Antonio area. She's going to be carrying that bill for us this year, and she's very passionate about it. Last year, she was voted as Rookie of the Year in the legislature. So she definitely wants to keep that status going, and she's very passionate about this. We think we're very, very close to having a Senate bill. That Senate bill, we're thinking, may happen this Friday, if not maybe early next week. So having those two bills very early on in the legislative cycle is going to be very important to us. We've only got 140 days every 2 years in the Texas legislature. So you think about how big of the state is, and you've got education, you've got healthcare, you've got bathroom laws, you got all sorts of stuff going on, right? So there's a whole lot to be discussed in 140 days. This year, we've got a new Speaker of the House. His name was released yesterday, and that speaker will start assigning different members to be chairs of different committees. That hasn't happened yet, but that'll happen soon. Once the chair of those committees is assigned, then they'll start filling in the committee members. So it really depends on who's going to be chairing these committees as to which committee we decide to bring these bills to. So previously in the years past, we've gone Health and Human Services. We met some roadblocks there, and we can chat about that in just a second. Last year we went Business and Commerce, thinking that basically it's in our degree, it's in our job description to be able to evaluate and treat. So we went that direction last year, and we met the same roadblock that we had in the Health and Human Services committee. So that's where we're at. We're waiting for the chairs to be decided, and then once the chairs are decided, we'll know which committee we've got a better shot to get this done. And then we'll start really focusing on some key individuals that are in those committees. And I'll let you guys speak to the recent change in the Health and Human Services.
Yeah, I mean, I think the thing to note is that Senator Dr. Schwertner was our largest opposition in years past as chair of the Health and Human Service Committee in the Senate. He is an orthopedic surgeon from Georgetown who was very vocal in his opposition to our efforts. In addition, the Texas Medical and Texas Orthopedic Associations were also very vocal in their opposition to our efforts. Senator Schwertner has resigned from the chairmanship of the Health and Human Service Committee, and as Lieutenant Governor Dan Patrick also acknowledged that it was his intention to remove him from that position. At the same time, he had announced his resignation because the report from UT was inconclusive, or not inconclusive, but Senator Schwertner did not cooperate at the level that was hoped that he would cooperate with the investigation. I think that where that's left us as an association, a profession, and in a position to achieve success with our direct access is we have identified Representative Minarez as a champion of our bill. I know Dana, the GAC, and Craig, our executive director, have identified a potential senator to carry that bill in the Senate. Conversations are happening with our new lobbyist, William Brannon, to best facilitate that assignment to the committee that we think will give us the best success, whether Health and Human Service or Business and Commerce, as Dana had alluded to. The oppositions that we faced in the past, Senator Schwertner will not be in opposition this coming session. His party has largely said that based off of his current predicaments, that their best efforts are focused on the issues that are most important to the party at this point, and not focused on his priorities, just based off of his current situation. I think the overall attitude and climate of the legislature as it relates to the TOA and the TMA are one of fatigue, just based off of the nature of how they've chosen to address issues in the past 2 or 3 legislative sessions. They've taken a very aggressive tone, and legislators are largely fatigued and tired of that approach of, the paternalistic view that we know best and, we know what's best for the patient. I think more and more we're going to see our legislators realizing that patient choice, especially like I said earlier, in the eyes of opioids versus physical activity and prescribed controlled movement and improvement in function, are a much better option than narcotic prescriptions. So I see a lot of potential on the horizon. I also see the need for us to mobilize ourselves more than ever. We need to get our colleagues excited about direct access. We need to get our colleagues talking about it in various mediums, getting on social media, talking about patient stories, talking about how we directly impact the patients we serve on a day-to-day basis, and helping us move this needle across the end zone.
Yeah, I completely agree with both Dana and Mike on all of those fronts. The new Speaker of the House is Dennis Bonnen, who hopefully will do a good job of leading us through this session. But I really do want to stress what Mike was saying, is that this year is different than other years, right? There's a window of opportunity for us to capitalize on the current situation, not only with certain individuals, but really kind of the state of government as a whole. I think there's a large push for a lot of free market and a lot of opportunities to unrestrict trade of many professions and limit regulation. And I think this is one of the opportunities that we can capitalize on as well. And so if I know from being a part of this for the last 4 or 6 years that we've done this, Mike and Dana, that this year is the time that we need to really rally our voices and get excited about the opportunities to connect and to tell our patient stories, and to get our patients to tell stories at the Capitol this year. I have the best feeling about access that I've had in a long time, based on the current situation and who's coming to the table and who's agreeing to work with us, and everyone who's at the table. So it's time to light the tires and light the fires and kick the tires and really work hard at getting this thing pushed through with the support of everybody in this state. We need everybody on board.
As Ricky Bobby and Cal Naughton Jr. said, it's time to shake and bake.
Shake and bake. Exactly.
So that one particular physician, he's been an adversary for us for a long time. And the state with the Texas legislature is that we've got more MDs in our legislature than any other state. And the good thing this year is that they're not all against us. They're not. There was a certain few that were basically voting per their own interest and not their zip codes. And those people don't have the power that they once did. And so between that situation, the focus on getting people off of opioids, and as Mike just said, that trying to sort of open up access to people that are underserved, and really trying to give people the ability to practice at the top of their license, and to give people the access to do what they're trained to do. I think like both of these guys said, the opportunities we've got this year are really unprecedented, and we've got a real good shot at this.
Well, gentlemen, again, thank you so much for your time. I'd like to wrap with this one final question. What are some actionable steps that physical therapists in Texas, and even patients and the public in Texas, can do in order to really make an impact on this next legislative run we've got coming up?
I think it's about telling stories. I mean, I think the illustration of our direct access effort is no different than, marketing our services to potential patients and referral sources. We need to tell the legislature and the general public about what we do on a day-to-day basis to impact the lives of our patients. We all have stories of patients that we see on a day-to-day basis, and telling those stories, whether it's a child with cerebral palsy that a therapist is working with to help improve their independence, or a patient post total hip arthroplasty where, we're working to get that patient back to their prior level of function and get them back to their activities of daily living. I mean, those are the stories that we encounter every day, and we're so bad. One of my favorite quotes is PT became the new Fight Club. The first rule of Fight Club is don't talk about Fight Club. And I feel like that's what physical therapy became in the last, 5 to 10 years, is we do so many great things, but we don't talk about ourselves. We don't talk about what we do to impact the lives of the patients we serve. And I think it's a disservice to both our patients and to our profession. So I think the best thing that people could do is actionable. I mean, ideally, we always want people to give time, talent, and treasure, right? We want them to give their time to become a key contact, to contact their legislators, to educate their legislators and the public. We want them to give their talent. We want them to utilize whatever communication mediums that they have, to reach out to social media, to talk about the impact they're having on their community, on their patients. And of course, we want, to Dana's point, PAC fundraising. We want them to give to the TPTA PAC. We want to give to the APTA PAC. We want them to support our legislative efforts, in a monetary way as well. And we welcome any combination of that. If people can give their time, that's great. If people can give of their talents, great. If people have opportunistic income that they can part with at this point, and help support us at the state and national level, we appreciate that as well. But we need to get up. This can't be any more of an effort of just the few. This needs to be an effort of the many. I'm thinking of Braveheart when William Wallace stands in front of the troops at the last battle, and he's saying, we're going to fight for our freedom. I feel like this is our fight for our freedom. This is our fight for direct access. And if we truly want this needs to be an effort of many, not just an effort of few. My favorite quote is from John F. Kennedy, and it says, one person can make a difference and everyone can try, or everyone should try, excuse me. And if we're going to truly make a difference, everyone needs to do it. There's no effort that's insignificant. There's no effort that is not going to make a difference in this direct access battle. This is not going to come to us cheap and easy. This is going to be an all-out fight. And if we truly want to make a difference in the lives of our patients in 2020 and 2021, between now and the next legislative session, then everyone needs to make a difference, and everyone can. And we just need to show up. We need to let our patients know that this is about them. We need to let the legislature know that this is about our patients and the patients and clients that we serve, and finally get this done.
Rock on, Mike. I completely agree with all of that. I'm I want to take it one step further. I think that we all need to acknowledge that physical therapists can be primary care providers and be a person that patients go see when they have pain. Like, we need to step into that role. We need to be okay with having that role. And that doesn't mean that every PT out there has to assume that role. It just means that we all have to acknowledge as a profession that we're ready to have that step and be that person in the state of Texas and own it, right? We can't be a divided profession in this fight. We all have to support this from inpatient to outpatient to private practice owners to pediatrics to all the PTs need to come on board with this and support each other and support our profession to be the best it can be and practicing at the limits of its scope. Like, that's what we really need to do. And if you're passionate enough and driven enough to be a part of the movement, reach out to your district, reach out to Mike, reach out to the TPTA, reach out to me or Dana, and get involved. Ask how you can be a part of what we're doing, because we need you. We need your voice. We need your support. We need your connections and network. We need you to be a part of this. It's not about me. It's not about Mike. It's not about Dana. It's not about F Scott. It's about all of us working together to achieve the goal of access for our patients.
Yep, absolutely. And there's some real simple things that you can do. We've already kind of finished up our PAC fundraising for the year. We always can still donate money, but we're not necessarily looking for that right now. We're looking for you or your patients to contact your legislators, and you can do it as easily on Facebook or on Twitter if you're not comfortable having a phone call with them. If you don't have a relationship with them in your hometown, you can reach out to them on Twitter or Facebook. Most of them have sites. Most of them will check those sites. Tell them what your issues are. They'll listen, right? You can go to Austin on February 19th. I know in Houston, we're taking 2 or 3 buses of PTs, PTAs, PT students, and patients to Austin to speak to those points. I know other districts are going to be doing the same thing. Once we identify which key people that we need to focus on, we'll start putting that stuff on social media. And if you live in those districts, then it's going to be really, really important that you get a friend, to do the same thing. You get a friend or you get a patient. Patients even better. Those patient stories are way more impactful than our stories, to contact those legislators. And previously in other years, a lot of PTs that maybe don't work in outpatient, maybe work in other facilities, this hasn't been a big issue for you, right? But I don't think there's a single one of us that can say that we haven't had a patient or a family member that's not been impacted by opioid abuse, right? Or opioid addiction. That impacts us all, so it's not just about, a private practice owner trying to make more money for himself by getting more patients in. This is impacting our communities. It's impacting our school teachers. It's impacting everyone out there right now. So we've got to put a stop to this. And Texas is way behind on this, So it doesn't matter what practice setting you're in as a PT. We can all definitely help, and end this problem.
And to kind of dovetail on what Dana had said, there's also an app that you can download from the Google Store, from iTunes. It's the APTA Action Alert app, and we do have a state government affairs section of that where you can contact your local legislators directly through that app. If you also go to Google and you go to who represents me, as a search in Google, it'll bring, based off your address, who your local representatives are at the local, state, national level. And almost all of them have a link directly. So even if you don't want to do the social media thing or you don't want to call them, an email is just as good as reaching out. So it's another mechanism to reach out to those individuals and educate them about our issues.
And on that same app, I uploaded that PT Action app. I uploaded our House bill with all of the wording. I uploaded all of our talking points on opioids. I uploaded the time that it takes to see a care provider in the state of Texas if you're in pain. There's several talking points and resources for you on that app now.
Yeah, that is amazing stuff, guys. I mean, I can't thank you all enough for taking the time to come on and just talk about this stuff. I view all of you as my William Wallace. So thank you for your time tonight. Thank you for your efforts. yeah, Texas, get out there and look at this stuff. Look at the talking points. Look at the research. All of this stuff will be listed in the show notes. There'll be links so that you can sign up for the legislative day. Mark, if you want to just kind of review some of those dates, and like I said, they'll all be in the show notes. So let's get behind this thing and let's really make a change.
Yeah, we have, in the capital area district, which is around Austin and the surrounding areas, we've got an important capital area district meeting coming up on January 14th, where Dr. Janet Besner from Texas State will be supplying a talk on the legislative session and upcoming issues with the TPTA and getting people on board and getting knowledge out there for that. I know, Mike, you have an upcoming meeting up there, correct?
Yes, sir. On Tuesday, the 14th, we have Linda John, and from APTA, we have Director of Government Affairs, Angela Schumann, that will be in to educate us about the legislative process, both here and at the national level.
And then we have the one other event that, Mike, you spoke about that also has a social event here in Austin.
Yep, February 4th, you have the Texas State of Reform Health Policy Conference, and the Capital Area District is sponsoring a reception that evening. So that was on the Capital Area District's Facebook page with information on how best to RSVP for that event. Yeah,
so there's a lot of stuff happening at the Cap or in Austin and over the next few weeks that you can get directly involved in. You can reach out to me, Mark Milligan, dpt@gmail.com, or you can reach out to me on social media. We can get you connected and get you where you need to be, or you can go to the Capital Area District Facebook page.
And please don't hesitate to reach out to us. I'm president at tpta.org. If you have any reservations about approaching your legislators, any of us are happy to be a resource. Like I said before, this is not an effort of few. This needs to be an effort of many. And we want as many of PTs, PTAs, and students involved in this effort, this legislative session, as we can.
And again, thank you guys so much. You're all such inspirations. You've moved me to get up and go to my representative tomorrow. I've got a little bit of free time, so that's how I'm spending it tomorrow. Thank you again all for your time. And like I said, Texas, let's get behind this. Check out all the resources. There'll be links in the show notes. Let's make a positive impact and change.
Access to healthcare is one of the largest issues facing both providers and patients, as millions of people worldwide lack timely and affordable access to healthcare. Anywhere Healthcare, a telehealth platform, is a simple, low-cost option for providers and patients that eliminates the barriers to access to all kinds of healthcare. To find out more, check out anywhere.healthcare, which is available in our show notes. And if you use the code HET in all caps when you email to sign up, you'll save 25% off the total cost. Thank you for attending class today, and we hope that you learned something and gained value from the content.
If you'd like to schedule office hours with us, feel free to add us on Twitter at HET Podcast, on Instagram, HET Podcast, on Facebook, the Healthcare Education Transformation Podcast, and the homepage, healthcareeducationtransformationpodcast.com.
And for those of you following along in the syllabus, extra credit can be obtained by liking us, sharing us, and leaving a review.
Let's continue our journey up Mount Educational Success as lifelong learners.